Okay. So, welcome everybody. Bienvenue tout le monde. Je suis très heureuse de vous voir ici en si grand nombre. I'm very happy to see so many people here for our wonderful webinar. I am Marian Dove. I am the chair of the Department of Family Medicine at McGill University, and I am delighted to welcome you all to this webinar, which is part of a series of global health webinars that is run jointly between the Department of Family Medicine and the School of Population and Global Health. So this is the fourth in a series. We started in January, and it will be equally as brilliant and scintillating as the first three, I am sure, if not more so. I want to take advantage of my role in welcoming you all to invite you to follow the Department of Family Medicine on social media so that you will be aware of any upcoming events. So we have a Facebook, a Twitter, and all these other modern things that people like me don't actually know about. Maybe we even have Instagram. That sounds like something we might have. So please, those of you who know what those words mean, follow us on social media. You will be happy because you will hear about upcoming events. And those of you who are old fogies like me, we also have a department newsletter that comes out once a month, and you can find information about our upcoming events in that newsletter. It comes out at the end of every month, and it is put together by our brilliant communications director, Yasmin. So it's an excellent way to find out about the next webinars. We have workshops also, and the next one is coming up next week, exactly 1 week from today, next Wednesday at noon. So if you're interested in having a more type of discussion about global health, I invite you to come join us next week. With that, I'm going to turn the floor over to my sidekick, Tim Evans, who is the director of the School of Population and Global Health, who will be even more eloquent than I am in introducing our speakers for today.
Great. Well, thanks very much, Marian, and welcome everybody to this third in our really very exciting series. Just for those who may be joining for the first time, this is, we've really been looking at the opportunity of learning from myriad perspectives, public, private, local, global, on opportunities to enhance delivery of frontline services or primary care, and that interface with public health, very much in the spirit of listening and learning. And so I think today we've got a great opportunity with our two Indigenous leaders who will be introduced by our moderator, Dr. Alex McCumber. And Alex, thank you very much for agreeing to moderate. I'll let you do the introductions of our speakers, but I just wanted to thank you and both of our speakers ahead of time, and really looking forward to this, this session. Over to you.
Good morning. Thank you very much, Tim and Marian. Greetings to everybody here. We welcome you to the webinar, but also it's an opportunity for me to offer a welcome you to Haudenosaunee territory. I'm Ganyanka Haga Rodiskarewage, Bear Clan from Kahnawake, which is just a stone's throw across from the island of Montreal, and you're on Haudenosaunee territory, and our responsibility then is to welcome you to our territory and to give you greetings on behalf of the people from the community, but also from our ancestors, because we, when we walk our journey, we're responsible for carrying those good words and messages forward. And trust that your stay with us on the territory is a good one. And we just ask that that you treat the territories and the people and the life in that good and proper way. So we welcome you all here today. And but just before starting, I'd like to offer a bit of a dedication. I'd like to offer a dedication for for this session here. Dr. Tom Dignan is an Indigenous physician. He was a first graduate from the McMaster Medical School. He was also Ganyankahaga from Six Nations, Oswegan, where Dr. Hill is from. And he is one of the leaders, one of the trailblazers in advocacy for eradicating the disparities of health outcomes and inequities in the quality of healthcare that our peoples have been facing. He was very active in the Indigenous Physicians Association of Canada, where I had the honor and opportunity to meet him and Veronica and Karen and so many others. And he's an inspiration to all of us. And for the little bit that I got to know him, some just associate project work, I think is a small piece in comparison to what his colleagues, physicians experienced, because I know that they always gathered and had these amazing, awesome conversations, interactions, and that we all looked up to Tom. He passed to spirit world this past winter. So as a dedication and the focus of the topic of this gathering here, I kind of like to put his memory out to the front and know that he's probably wafting around and we'll be giving a little pinch and a kick here and there when necessary. So it's a pleasure to have you all here today on lessons from Indigenous primary care and well-being. It's a pleasure to have been asked to be the moderator here and to get to introduce a couple of friends from way back. I shouldn't make it sound that old, right? About 12 years ago, when Indigenous Physicians Association of Canada was working with the faculties of medicine and the Royal College in developing core competencies for health professionals, requirements around recruitment and retention of Indigenous students into medical school, and curriculums, cultural safety curriculum. And we didn't call it back that day, but it was very groundbreaking. And I know that Dr. Hill and Dr. McKinney, among others, were at the tables in so many conversations around this. So a quote that was put out from an article, Characteristics of Indigenous Primary Healthcare Service Delivery Models, a Systematic Scoping Review, states this: Indigenous populations have poorer health outcomes compared to their non-Indigenous counterparts. The evolution of Indigenous primary healthcare services arose from mainstream health services being unable to adequately meet the needs of Indigenous communities and Indigenous peoples, often being excluded and marginalized from mainstream health services. Part of the solution has been to establish Indigenous specific primary healthcare services and for and managed by Indigenous peoples. And so how we'd like to have this presentation done today is what we're increasingly calling among the Indigenous communities is kind of a kitchen table conversation. And so for the first part, when I introduced Dr. McKinney and Dr. Hill, we're gonna kind of just turn it over to them to be chatting, and they're gonna be catching up with each other and sharing what they'd like to share about this topic in their varied roles, etc. So that's enough talking from me. I'm going to just give a brief introduction, and certainly, as in our ways, we introduce ourselves in more depth in the ways that are comfortable and appropriate to us. So starting with Dr. Karen Hill. She is also Ganyankahaga and a family physician who works at Judah's Place, a clinic that she co-founded at Six Nations of Grand River. That's Oswegan territory in Ontario. Judah's Place incorporates traditional Indigenous healing alongside primary care and also trains family medicine residents and apprentices of traditional medicine. Dr. Veronica Kinney is of Cree and Métis ancestry, a frontline practitioner, professor, and healthcare leader in Saskatchewan as Director of Northern Medical Services. And this provides healthcare services to 40,000 people living in Northern Saskatchewan through agreements with the Indigenous Health Services Canada, Saskatchewan Health Authority, and the University of Saskatchewan. So I'm going to invite Dr. Hill to speak first, to introduce herself, and to just share some opening thoughts and statements, and then we're going to move it from there. After a while, we then will take a little stop, and we'll then have an opportunity for participants to type questions into the chat as we go along and follow up with discussions that'll evolve from there. So this is a very fluid conversation. It's a gathering of some friends, and we'll have our virtual coffee and tea around the table. So Karen, Dr. Hill, I invite you up first. Unmute, please.
Okay, Sego Sewaguego, Galana Uwe Yangyat, Ganige Haga, Niwakwan Joda, Waganyata. My English name is Karen Hill. I am Mohawk from Ashwegan. I am Turtle Clan, and I am a family doctor. I've been working in primary care since I started my work. I actually started out in community medicine in my residency and very quickly realized that it was training that was not my idea of community medicine. So I switched to family medicine. And I started right away working at Six Nations to support the development of the family health team. So at that time, they were in the second iteration of proposals for the family health team. And the community had already submitted for the initial call for proposals, but they didn't get funded. So I started doing that work right away, and we got the funding. And within the first year of when we were first just developing the plan, I was approached by a friend of mine who is, sorry about the cat, a friend of mine who is a cultural anthropologist and works at McMaster University. And she said, Karen, there is a group of traditional medicine practitioners that want to meet you and talk with you. And I said, okay, let's set it up. So she arranged a time, and I went to this meeting, and I met with a group of the traditional medicine practitioners from my community, whom prior to that, I did not know who they were. Like I didn't know who the traditional medicine people were in my community, because the traditional medicine was still there, but had very much gone like quiet and in the hiding places for a long time. At Six Nations in 1924, the RCMP came with automatic weapons, and they arrested our clan mothers and our chiefs and our medicine people. So our medicine people stayed in hiding. And that always something that amazes me, that in general, Canada thinks that we've all gone away because like they arrested us, we should be gone, but we're not. We just kind of went to the, into the background. And so when I met with them, I was surprised that there were a few of them that I did know in other capacities, like as language teachers, just as elders, but I didn't know that they were also medicine people. And one of the medicine people that became the lead medicine person that worked with me in my clinic, initially, Christine Sky, she's passed now. She said to me, we've been watching you, and we're ready now to work with the Western medicine, and we want to work with you. And I was kind of shocked, right? I was like, wow, they've been watching me. Because prior to that, I had been working at Six Nations Polytechnic, which is a post-secondary institution run by our community on reserve. And so I said, okay, tell me what to do. Tell me what you want me to do. And from that point forward, everything that I've done in my practice has been what they told me they needed me to do. Because one of the things that brought me to medical school was an understanding, I call it a vision, that was given to me by one of our chiefs. He held the title Daskahe, and he was an educator and a principal as well, Harvey Longboat. And the vision that he had given a group of us when we worked at Polytech, he would come and meet with us periodically. And basically what he said is, we don't need permission to do what we know we need to do for our people. And we don't need funding, and we don't need government understanding. We don't need anything. We just need to do what we know we need to do. And through my work at Polytech, started in the early 90s when they first started as an institution, as an organization. And I had the opportunity to work with a lot of these elders and knowledge keepers in my community, most of whom have passed now, and hear what they were saying. And what they were saying is that we need to embrace our own knowledge again, our own teachings, our own languages, our own ways of being. Don Martin Hill, who is the anthropologist that is from our community, actually made a series of movies in the 90s. And one of them was called Jadwado. And that translates from the Cayuga language to let's become again. Because that's what our elders have been telling us now for a long time, is that we need to just trust that we know stuff, that in our culture, we know things. And we have the ability to pick that back up again now, and we don't need permission to do it. So when it came time for our work to expand, and my work with the traditional medicine practitioners, because quite quickly, within the first 2 years of us working, we got a little bit of funding from the ministry for a traditional medicine program that was 2 days a month. Within the first 2 years, the amount of people that started accessing that service just rose exponentially. And we found ourselves needing space where we could actually fully collaborate with each other outside of the Western governed system. So even though the family health team was on the reserve, the band council was administering it very much as a Western system, like a family health team, which didn't give us the latitude to actually work the way we needed to work to meet the needs of our people. And so that's when, unfortunately, my community told me that I had to leave if that's what I was going to do. And you can't unknow what you know. And I knew that that's what our people needed. And so I left, and Christine unfortunately passed at that time. So one of the other traditional medicine practitioners, Alva Jameson, her and I met the day after Christine's funeral, and we talked about it, and we decided we have to keep going. It's what the people want. It's what they need. We have to keep going. And so we started Judas Place with nothing, with no funding, with nothing, with just what we knew needed to happen. And a community member came forward and offered us a space for free. It wasn't just free, it actually was set up like a clinic, because she was running a spa out of there prior. So it had like clinical rooms, and it was amazing. And so we stepped into that. And so a lot of my learning around what is primary care for our people, it's not what the Western system defines it as. It looks very different. And it is founded in our own knowledge and in our own ways of doing things. That is what true primary care for our people looks like before the intrusion of Western medicine into our healing ways. And that's not to say that there isn't a place for Western medicine. We need that now, but there needs to be a balancing that happens. And this role that the physician takes at the center of healthcare is a stolen one. And I had to acknowledge that and start the work of shifting out of that position so that our people that really had that traditional knowledge could come forward and support them in making that transition as well. So that's the work that we've been doing at Judas Place. I'll share a little bit more after Veronica speaks. Nyawa.
Yo, Nyawa for that, Karen. So interesting. Lots to hear and learn about. So Veronica, Dr. McKinney, welcome. And your opportunity now for your introduction and to have some initial sharing.
Bonjour, Tansi, Tawao, Exenifica, Veronica McKinney, Nia Otineo, Saskatchewan. So I'm a Cree woman. I always laugh at the word Cree because it actually comes from French, which is because we had loud voices when we were singing, and I guess it sounded like we were crying or screaming. But our word, Nihiawan, means that we are balanced people. We are balanced according to our medicine wheel. So I guess, similar to Karen, I've gotten a lot of traditional teachings. I was very lucky that my mom, I always go back to my parents, and that's, I guess, the way that we look at things in our communities. But my mom was born quite premature, and she was delivered by my great grandmother, who was a traditional midwife and a healer. And she was raised by my grandmother, or by my great grandmother. She was, when the doctor came up, she grew up in the northern part of our province, which is part of the northern half that I now look after. And the doctor came up and said she was so premature, she was less than 2 pounds. So they signed her birth certificate, but they also signed her death certificate. And I never realized until I'm quite a bit older, what a gift that was, because my mom learned so much, and she taught us so much, and we were brought up in this atmosphere of learning all of these things, which I never ever realized that most people never got those opportunities to learn. I even remember going to a Sundance in the middle of the bush, and how covert and hidden it was at that time. I was only about 6 or 7 years old. But again, how lucky I was to be able to do those things. But as I looked around, and I was raised in the city, and I get to spend my summers up north. So, I looked around, and the treatment that I saw for people, and the lack of knowledge and the lack of healing that was going on within my own family, but within others that I knew as well. And the difference that I saw in how people were being treated made me quite frustrated and angry. My parents are a bit of activists themselves, and I guess I inherited that as well. I always laugh. My mom was at one point on something like 40 committees, and I thought, how the heck do you do that? And here I find myself doing very similar type things. But anyways, so some of the things that I've learned, even going through medical school, my mom would often, if there were people in the hospital, she'd send, the pickle jar full of teas or things like that, but go talk to this person. And I think of the gift that was in being able to meet with people and talking to them and hearing their stories and building those relationships with people. And to this day, even the fact that I went and talked to people at their time when they were the most vulnerable, really allowed me to learn. And I think what a gift that was. But those people still remember me and still come back and talk to me and feel comfortable. So some of the things that we learned, and part of our teachings, is the idea that everything begins in relationship. And it's not only relationship with one another, it's relationship in the grander scheme of things, in terms of our relationship with land, with the sky, with Mother Earth, with our trees, with our rivers, with everything, that we're all connected. Our communities are connected. We talk about the Moccasin Telegraph. I mean, holy crow, our communities are huge. I always tease I'm related to probably every person. I can find a connection with the whole northwest part of our province. We've got a huge province. I used to work emergency. So I'm a family doctor that did my extra year in emergency medicine. I've done a number of things. I was a nurse, I was a lab tech, and then I went into medicine. So I've kind of taken the long and tortuous route, but it's also been a really amazing route, because it's given me the opportunities to see and do a lot of things. I used to work with young offenders. I worked in the federal prison system for a while. I've worked up in various communities in the north, in particular, northern Saskatchewan, BC, northern Ontario. So it's really given me a lot of ability to look and see a lot of different things. And at one point, I also worked with an international air ambulance company. So I've got to see many systems around the world and what's actually going on. But what I see for our communities is that our health disparities really haven't changed at all. And, I remind people, we are named in the Canadian Constitution. We are the original peoples here, and yet we're treated as second-class citizens in our own country. And certainly healthcare is no different. In fact, I would say it's one of the tools that's used the most predominantly. And you look at the difference in how people are being treated, and we're seeing a lot of the reports and things coming out. But part of what I was taught when I was growing up, and what I still do, is this idea of relationship and how we must start with that, whether that's relationship with the individual, with the families, with the communities. And in my current role, well, I've got multiple roles, but one of the roles I have is as the Director of Northern Medical Services. that's more on a larger scale. You know, we have the provincial government and the federal government and the university, which are huge institutions. But one of the things that I absolutely insist on is that we have to have our communities sit at the table in a circle, the same as anybody else that's there. They have just as much say and power, if not more. We have our tribal councils, we have our community representatives. The area that I look after is just about the northern half of the province geographically, but we have greater than 85% of our population are Indigenous. We have a mix of all kinds of different backgrounds, whether it's Cree, Dene, you know, Métis. Greater than 65% of our population are First Nations. Half of our total population lives on First Nations territory. You know, our province likes to say we have one health authority. We don't. We have two. The second one we have in the far north is similar to BC's for First Nations Health Authority. It's the same thing in the north, that tripartite agreement, except for we beat them. We were there doing this from 2006. So we've got a large number of different groups and peoples that we're working with. And I think, again, this speaks to me, this whole idea of relationship and how important it is to build your relationships. And I often tell people as physicians or people going into community, the first thing that I think you should be doing is going and introducing yourself. And it's like any relationship. I mean, we know we don't have great success rates in our country in terms of divorce rates and how much work it takes to do relationship. It takes as much work to do relationship in our communities as well when we are working with them. But I really believe in that saying, nothing for us without us. I mean, you have to have the people who are affected be part of all of these things. And our people know what we need. You know, we've been living in these ways for such a long time. When I look around, like I said, when I think back to my own childhood, and I work also in an inner city clinic where, again, I serve predominantly Indigenous people, a lot of people with HIV, a lot of people with IV drug use, and a lot of families who are living in poverty, a lot of young children. You know, the reality is that most of those people have never had the opportunity to participate in any form of knowledge or ceremony or any of those things. So when we have those opportunities to share that, and it's nothing major, you know, sometimes it's just sitting and talking, just like we're doing right now at a kitchen table, having a cup of tea and talking. But the more you can make it about that relationship, the better off it is. I really find that is huge. And you have to be open to reciprocity, which means we have to be open to learning as well. And I often feel like, even though my intent when I go in is to help, I feel like I learn so much more about myself and about and reflecting on all these different pieces and how they all fit in than I do, you know, really for helping the individual, which sounds a bit self-centered, I guess. But even though the more I try to focus on the other person, the more it comes back to our own ways of being. I think that idea, like, so when we work with Northern Medical Services, like I said, we try to do things right from in community, everything from mentorship and such, and bringing people in, trying to train, you know, training in the Western way. But, you know, more and more we're seeing that the need is to actually really incorporate our Indigenous ways and allow people that opportunity to be either to be exposed or to be able to practice in that way. When I was going through medical school, my saying was I have to join them in order to beat them. And I have always done my traditional ways. I don't know any other way of doing it. But I also know that that's the medicine that is the most healing for people. And I'm not talking about necessarily the herbs or the teas or the things that we make. That's a small sliver of what we do. My teachings are much grander than that. And I know that they are different depending on which, you know, group you're with, whether, you know, which nation you are with. But there are some commonalities, but the point of the whole thing is that it's so much more than that. And when I look at even my non-Indigenous patients, they are craving that. Our scientific way likes to think that it's all knowledgeable, all powerful, that it's scientific, it's objective, that everything is encompassed in that, but it really isn't. And it doesn't speak to these other pieces. And when we look at other countries around the world, it's the same thing. So taking that time to really learn from the community and to really connect and connecting with everything around you, looking around, whether you're in an inner city or whether you are in the north, figuring out where are those spaces, where are those places that people are at, where can we connect with the earth, where can we really connect and feel and really calm, you know, those calming things that we can do. All of that is part of our primary care. Each of us has our own journey. So I agree with what Dr. Karen is saying as well, in terms of really listening to the people and letting them guide you, telling you where they want you to be and what you want to happen. I've had the honor of working with many traditional people, and they're, you know, the funny part is they're often surprised that I even ask for their opinion to begin with, or that we talk. But when we do, that medicine is so powerful, and we're seeing more of those examples in our communities, in our province as well. And being able to access that for people is just so powerful and so meaningful. And we know that there's numerous studies out there that also shows this. So you know, like I said, I know that these things work. It's not a question. The hard part is trying to convince the leaders and the you know, the government and the universities that this is powerful, it's meaningful. You don't have to become a traditional healer yourself, but you have to be able to be in relationship with people and be in relationship with your environment, with your community, with all of that, and that entails. But it also means you have to be there and be committed to that. It's not a one-night stand kind of thing in a relationship. And so, and I think sometimes, sadly, the way healthcare is delivered to our Indigenous people is that one-night stand, plopping in for a visit and then out. There's no relationship there. So how can you have trust? How can you have reciprocity? How can you work together on the journey to help that person find where they're at? So those are just some initial thoughts that I have that I thought I would share with you. But yeah, I'm open to any questions, or and I hope that was helpful a little bit, but we'll leave it there.
Veronica, for sharing, and again to both of you for this first sharing. Like, wow, everything comes out, and it's a huge buffet of knowledge and information from experiences, huh? One of the writing themes that comes through with both of you is around the holistic perspective of wellness, and how important it is of engaging community members, patients, with that in mind. So when we talk about holistic perspectives, at least in diabetes prevention research, we've been putting a W in front of there since the late 1990s, coming out of NADA, National Aboriginal Diabetes Association. And we've been pushing that because it's about being whole, all-inclusive. There's no whole like a donut hole. And we had that diabetes analogy. So I'm going to ask you both then to kind of like taking that platform, just kind of share some thoughts around that, or into a little dialogue with each other around these holistic perspectives, the value of it. And I guess also, how do we get that notion across to the Western scientists and scholars, et cetera, of opening minds to looking at our knowledge, our science, our perspectives? So I'll leave it to you, to one of you, to start with some thoughts.
Okay, I'll talk for a few minutes. So when I think of holistic care, and I know generally speaking, in the Western sense, when people talk about holistic care, you know, they tend to talk about, you know, we have to think about all of the person's needs in terms of, you know, what are their mental health needs, what are their social needs, what are their physical needs, what are their emotional needs. Even spiritual care is included in that, right? When they talk about that. And what I see for Indigenous people is that holistic care, holistic health, holistic approach also has to include our own Indigenous perspectives in every level of the healthcare that is being offered. So that includes, you know, Indigenous healthcare practitioners being involved in, you know, being the ones providing the care. Like we said, nothing for us without us. you know, because there is still a lot of mistrust in that the medical system was a key player in, you know, the whole colonization and assimilation process of our people across the country, that there is a lot of mistrust. And our people, in order for the care to be holistic, it has to include our people as the providers. It has to include our perspectives and our ways of doing things in the way that care is provided. And I'll give you an example. At the clinic Judith's Place, which now we've sunsetted that, you know, there's Judith's Place there, but it's just the traditional medicine piece that's running there right now. And we're working on bringing the Western back together with the traditional, as soon as we can get some support to continue that. But for example, if a person came in, there were many times that we would schedule an appointment and they would see all of us, you know, and we might ask them to bring somebody with them. I remember meeting with the whole family, mom, dad, 5 kids, and we all sat around the kitchen table, and there was myself and Alva Jameson, who was a traditional medicine practitioner that I was working with there. And we met with this whole family, and they came from Ottawa to see us on Christmas Eve. And so we met with them for a couple of hours and listened to them, just listened to what they had been through as a family, listened to what they were struggling with, and listened to what it was that they wanted. And, you know, holistic means you hear the person and you meet them where they are. You don't judge whether it's right or wrong. You don't say, well, you know, we don't usually do that in the Western system. You're kind of off there a bit, which is what had happened to this family. What they were asking for, they were told, no, the system doesn't work that way. We can't do that for you. And as a matter of fact, if you continue to insist on that, we're taking your child. And they did take their child. And then they let their child come home for Christmas, and they toot sweet got in their cars and drove to Judith's Place because they knew we would listen to them. And then I used my connections to the Western system to get a hold of a nephrologist and say, I have this family here and they're needing to see, this is their question. And I know that the Western system doesn't usually work this way, but I'm going to ask you if you can see this family. And they said, yes, send them in on Boxing Day and I'll see them. So the whole family went in to see the specialist on Boxing Day, listened to them, gave them the same answer that they were told before, but actually spent the time hearing them, hearing their concerns. And that's holistic. It's meeting the person as a human being and having that learning back and forth. I learned a lot from that family in just sitting and listening to what they had been through. I learned a lot from them on how to listen, on how to use my authority as a physician to help them to access the system in the way that they needed it to be accessed. So we often, you know, people often talk about, you know, Indigenous health and they talk around this medicine wheel, and that's fine, but it's more than that. It has to also encompass the system and how things are delivered. Because in what primary care setting would you ever have a physician spending 2 hours with an entire family on Christmas Eve, right? And they just showed up. They didn't call, they just showed up. And I called Alva and she came and we just sat and we talked, right? And we fed them and, you know, had that visit around the table, right? That's holistic. It's relationship focused, relationship oriented. And when we did our research project, I got a CIHR grant to look at Judith's Place and look at the work that we were doing. And that was something that came out of that study loud and clear, was that when our people witnessed other Indigenous people doing this work, and we shared openly in our relationship the healing that we were doing as well, you know, and that we would close the practice when it was time to fast, when it was midwinter, when it was time to do ceremony, we would say, you know, your appointment has to be rescheduled and we'll see you at Longhouse because this is what we're doing. the loud message that came out of that research project was that we are the medicine. It's us as Indigenous people working with Indigenous people. And it can be non-Indigenous as people as well. When you enter into that relationship wholly as a human being, you're a whole person, they're a whole person. You're not playing the role of the doctor or the nurse. You're in it. You're in it as you. That is when people heal. That is, they said things like, we felt equipped to develop our own tool bundles to be able to become self-determined in our own health and in our own lives. And to me, at the bottom of all of this disparities of health for Indigenous people in this country lies this altered sense of self-determination that has come out of a consequence of the colonization process. So the longer that the system, the primary care system, continues to function as I'm the doctor, I know, I will tell you what to do, those disparities will continue. You could spend as much money as you want on the programs, but if they're delivered in a non-person human way, which is holistic, you're not going to get the outcome. Right.
Yeah. Yeah, and I would agree with you, Karen, on that as well. I think the whole idea of the underpinnings of everything we do has to be based on our teachings, on our traditional ways, on our approaches, on how you would do this. And I guess one of the big teachings that I often tell people is we talk about circles, everything's in circles and the power of the circle. And when we sit in circle, you know, the idea is that we stand shoulder to shoulder. Nobody's ahead, nobody's behind. We each have something to contribute. We each are part of that. And it can be very healing if we can approach it in that way, but we all have that. The other thing that I would highlight in what Karen is saying, I think the other piece of that is it's so inherent in how we do it. We don't even think about it, but it's not that siloed approach. That's the other part that I find with Western medicine is that it's very siloed. It's very, this person does this and this person does that. And it's not like that, I find. And the other thing I will say is that the idea of a strength-based approach, often when I'm listening very intently, I'm listening for where are the strengths, where are the relationships, what's important to that person. And as Karen said, that only comes from really hearing. Another teaching we have, and I have a hard time with it sometimes, is mouth. And we're taught in medicine to be very aggressive and yell out and speak out. And if you don't, my God, you're an idiot. That's not how it is in our communities. You're an idiot if you're speaking out of turn. But by listening, you pick up on all those strengths. And the pieces that I find there is that often when I point out the strengths to people, because they have been portrayed in such a deficit-based way, that it is very difficult sometimes for people to hear where their strengths are, and they start to cry because they've never heard anybody say to them, wow, like you are so good at this, or you're doing this, that's fantastic. So we need to listen differently too, not so much about where the problem lies, but where are the strengths and how do we build on that? And you know, it does remind me of a global health story where there was a guy that was some kind of head of Oxford or something that was asked to go in an Asian country somewhere. And they had a lot of kids that were starving, like over 60% of their kids were starving. And so he went in and, you know, he was sort of set up in his hotel, and he'd go down and watch these people and stuff. And he wasn't really doing much. After about 6 weeks, the people that hired him said, well, so like, when are you going to get started? Because we really want to get this going. And he says, oh, I've already started. He said, I've been doing a lot of observing. I said, what I have observed is the kids that are actually healthy, their parents, their mom goes down to the rice paddies and she's collecting different little things while she's doing her work. She's collecting some shrimp and she's collecting some of the greens, and she's doing this. And she'll sprinkle that into their rice when she gives it to them. And she doesn't give them one bowl. She gives them a few different bowls throughout the day. So it's not any different in the amount, but it's how she's giving it to them. So what they did then is they took those teachings, they took those women who were doing that, and they got them to be the teachers to the other women. And they actually completely turned it around so that there was less than 50% of the kids that were starving in that country, just based on their own ways of approaching things and doing things. And I see that as being no different in our communities. We need to have people come in and watch and learn, where are the strengths? What can we do to support in whatever way we can? Sometimes that's running interference with the system that is actually pushing them down and not strengthening or building on those strengths that already exist. So that's what I was hearing and what Karen was saying, but I wholeheartedly agree. That's holistic medicine and giving of yourself, in that way. That's what we're here for. We have to be there as much as that person is present for us. So that means that's giving. We have to be there to do that as well, and not expect any kind of great gratitude. I mean, really, we're the minions in the whole thing. So, like I said, it's not that we are in that powerful position. I would say it's quite the opposite. And my teaching, like when my mom was being trained as a traditional person, as a midwife, that was her role. It's like it's everything. It's getting in, it's getting dirty. It's not the glamorous job of being this high-end doctor. That's not what it is. It's kind of the opposite, but it's really paying attention to that individual, to those families, to what are the connections, what's going on. We're taking in so much when we're listening, and we need to do a lot more of that. So that's I support what Karen is saying for sure.
Wow. Powerful sharings here. Thanks so much. And one of the things that just jolted in my mind around this then is our roles and responsibilities, that from in our traditional worldviews and understandings, we're spirit beings and make agreement with creation that come on this earth journey for a specific reason. And Anna, we're given that sacred bundle. And our elders and parents watch us as babies and grow up and help us to unpack that bundle and move us in those directions. But it's also then about living our lives to meet those responsibilities, which is about helping people and respecting and caring for Mother Earth and all life. So it does become, it becomes a life journey. And we need to step out of then the structures and constraints that Western society puts on us. Maybe a couple of words around that, as even maybe some advice for some of the people listening here who are maybe physicians, up and coming physicians, family doctors, etc., around that concept of the giving.
Well, I guess I'll start. I think it's exactly as Karen was saying. It's you just do what the people are telling you what they need. And it's not thinking about yourself or anything else. And again, that relates to hearing and really understanding what people are saying. Another example is even just today, I had a conversation with one of our medical health officers. I probably shouldn't be admitting this, but anyway, we have a lot of vaccine hesitancy in our communities. But there are people who our province has decided to go by age and age alone, which is a whole other ball of wax. But there are people in the communities that want to be vaccinated. And then, so we're having these empty clinics and we have a whole group of people that want to be vaccinated. And so, my medical health officer phoned me and said, I don't know what to do. I kind of feel like we should be doing this, vaccinating, but this is the protocol. And I said, you know what? Here we are. Let's just do it. I don't care. We have knowledge. We have ability. We've done all of the work. This is right for our community. And this is what our community is telling us that they want. Why should I be trying to force somebody to take something they don't want to take when I have other people here that really want this piece? So it's working with community. And, to be honest, a lot of people in the community want the vaccinations and a lot of people see the validity, but we work with the community, not forcing things upon them by any stretch, but they're telling us that. So I can run the interference for the government part. Let's just figure out how do we do this to support the community and what they need. There are other people in our communities that want to participate in ceremony, even though technically, I guess if you were to look at what the protocols are in terms of public health gatherings and things, and we had that at the beginning of the pandemic where the RCMP would come in. That's, rather than working with people, this was sort of the mentality. You can work with this. Karen and I are part of a group that we work together to look at how do we deal with some of these things to make it safer so that if people were interested in looking at potential ways, they have somewhere to go. So we did that. And some people will do that and some people will not. We all have free will, we all have ability to learn and such, but in those processes I've learned so much more. You know, to be honest, the communities know so much more than, and the individuals know so much more than they will ever give themselves credit for. And I feel my job is to better support them to be able to flourish in those decisions and decision making, and help them feel much more comfortable and empowered to do that and to enact that, because they actually know what's best for themselves. Just like I would not want somebody to be making all of my decisions for me. That doesn't work. And so it's the same thing. I don't see it as being any different.
Right on. Yeah. Karen?
Yeah, I forgot your initial sort of question, like that you were
around roles and responsibilities, and that which we bring forward, and that it becomes more than a job, and it's stepping out of the Western systems. And actually, one of the comments from one of the participants is around, it seems like an impossible task as Western and traditional practices are operationally dissimilar. Okay, so it's navigating the two worlds as we do on so many occasions. And just to give you a heads up that there's 8 minutes left for the time today. Okay.
Yeah, it's not impossible. It's very possible, but it starts with relationship. And I think like that's what I described and when I was first talking about how the traditional medicine people approached me and asked me about that. When they told me what they wanted and needed to have done, I didn't question it. I didn't change it. I didn't say, well, you know, that's doctor, I think we should do this. I just took what they said and did it. And that's an important piece. You know, we have to get to that place in our relationships where we value each other 100% for what we know. And I had to value that those traditional medicine people knew exactly how to function and how they were going to connect with that Western system. And when I said, well, what do you want me to do? Boy, they had it all figured out. Christine got up, drew a picture and everything. I was like, whoa, you guys are like way ahead. I would have never even thought of that. You know, she drew it all out and I was like, okay, I drew the picture. I took it and I just started, I presented it to the ministry. I got some funding. We started functioning in that way. There were a lot of the medicine people that I didn't even meet, that I've never met, because they do very specific ceremonies and stuff that I've never needed to be involved in. I don't need to know who they are. I just need to know that they know when somebody needs that, you know. And when we work together at Judah's place in a very close way, it's not so different. People want to think it is, and it's not. It's not so different. If a patient comes in or if they call, you know, our receptionist would talk to them and say, well, what's happening? What's going on? She'd be like, you know, and they'd say, maybe they would say, you know, I want us to come in and see Dr. Hill. And she might say, I can book you in to see Dr. Hill, but I think you could also use to see, you know, Elva or Val. That based on what you've told me, you know, that would be someone else you can see. And as a matter of fact, I can get you in to see them sooner than I can get you in to see Dr. Hill. So, you know, it works. It works. We use the best of what the Western system has to bring together in a coordinated way the work that we were doing. And as practitioners, we always kept the space open to learn from each other. So I did 4 years of apprenticeship training with the traditional medicine practitioners and the apprentices. And in that training, then they would always ask me, can you talk about the Western perspective, talk about your understanding of the liver, the kidney, the heart, the lungs, the nervous system, depression, why this, why that. There was always a back and forth, always, in everything that we did. And the only thing that system needs are two things: respect and funding. Because right now, the way that the primary care is delivered, it's like you're either a fit, a faux, or whatever. You're either one of these models, or we don't really know how that works. There has to be an openness, and that's that respect on behalf of the funders and the medical community, to just accept that we know what we know and we know what we're doing and we can do it. right?
Right on.
So it is translatable, relationship based, relationship first with your creator. Then that allows you to relate to the people around you and to the people that come to you.
Wow, we need to put on another pot of coffee to continue this going. This has been beautiful. It's a wonderful conversation, and you've covered so much territory. Nyao Goa, a big thank you to both of you for your participation, for sharing so many of just key points right from that very beginning of when going to community. What do you want me to do? That we're putting ourselves in that, recognizing that I have roles and I'm here to help. How does that go forward? And it's about also then recognizing and respecting community and patients and patient families, that they're the experts, that they are the experts, and not just in the physical health, but onagi and the whole, the house, the lifestyle, educate, all those social determinants also come into play around that. Just in closing, then I'm going to ask if you would each provide just a short to the point take home lesson for the participants from your experience and where you sit. Veronica?
I don't know if I'll start. So one of the things I often say is I don't treat it any differently than if I were going to somebody's house that was somebody I didn't know or meet. I would knock on the door. I would not presume to go into the kitchen and make the coffee myself and start doing all the things. I have to be respectful and to learn. And I think that's the thing. We each have something that we bring, whether we're Indigenous or not. You know, we have programs. One of them is called Making the Links, where we have our students go and stay in community for 6 weeks, and they're actually staying with families at that time. But the idea is that you are there to learn and to listen. It is not about what you're going to fix. You are not there to fix anything. You don't, and we don't need fixing. We need you to actually work with us. And it's interesting, the students that then come, I hire these same students afterwards as physicians. But they have such a different perspective. We are going there with hat in hand, trying to learn and trying to figure out what's the best way. We will never label ourselves as experts. I'm not an expert in you. You're an expert in you. And anybody, I will tell you, this is the problem with research, that, you know, all of a sudden this person is considered an expert in relating with, you know, Indigenous peoples. Well, it's garbage. And anybody that labels themselves as an expert has missed the point. The point is, you are not the expert, and none of us are experts in anybody else's. I can't go to your communities and say that I'm an expert. I don't know the first thing about what your communities need or want, or how they do things, or how they approach things. And I don't even think I would even say that about my own community. So that idea of, when you think about, if you're going to somebody's house and you're knocking on the door, how would you approach that? That's the mentality I want you to have, hat in hand. Just listen and learn, be receptive. Maybe they serve their tea with a different cup than you might. That's okay. Go with the flow, try to figure it out. How, and what are the parts that you might bring to the, what are something that you might have to contribute? You know, you might come to that house the next time and you might bring danishes that you really like or that you make. That's different than what they would have, but that's part of how you would reciprocate. So it's this idea of reciprocity. It's constantly figuring out and learning from each other. And my God, that is way more interesting and fun. And it's that healthy curiosity, because you will never, ever be bored. There are so many different people and so many different ways of doing things, but it is incredible. And the learnings and the teachings that you will take home. And that's where I started from, is how much I go there with trying to figure out that what I can offer, and I end up coming back with so much more, that it's just, it never seems to work that I'm doing anything more for people than what in fact, I get so much more than what I'm there to try to help with. So I think when you think about it in very basic terminology, that's as basic as it gets.
Right on, right on. Nyauko. Karen?
Yeah, I guess the thing that popped into my head when you asked that question comes from an article I read written by Ted Hohola, and he is from Albuquerque, from the Isleta Pueblo. He is the director of the Indigenous Design and Planning Institute at the University of Albuquerque. And in the 70s, he wrote an article as part of his master's degree or whatever. And one of the things they did was they looked at the community and they had like a consultation process, and they came out with these key tenets, you know, around Indigenous knowledge and Indigenous perspective. And one of them was, the people are beautiful already. And that really stuck with me because that's something that has been overshadowed by this whole process of colonization. It's been overshadowed in our own hearts as Indigenous people and how we look even at ourselves. It's been overshadowed in the hearts and minds of all of the newcomers in Canada and how they perceive us as Indigenous people, because the narrative got changed. The narrative got switched to, we're a problem, we're an issue, you know, we're not well. The narrative got stolen away. But the truth is, the people are beautiful already. There's nothing to be fixed, right? There's just a balance that needs to be reestablished. And that is the role that every person on this call has, no matter where they are and what they're doing in their work, is to remember that. And that the people are beautiful already includes yourself. We're all meeting each other in the same plane. So that's my takeaway message.
Right on. Wow. Yaogoa, Karen, Yaogoa, Veronica, Dr. McKinney, Dr. Hill, for your coming here today to sharing. We're on Indian time right now. The true meaning of Indian time is that we take the time we need to get our stories shared, etc. And so we do run a little bit over. Those of you with the 1 o'clock meetings like me, well, you have permission to be late today. But more importantly, thank you, Yaogoa, to the organizers for this session, and for inviting Dr. Karen Hill and Dr. Veronica McKinney to come to share. It's been a pleasure to listen and catch up. I have to go revise my first lesson of the course I'm starting in a couple of weeks, just from what I've heard today. It's awesome. It's so inspiring. As always, it's nice to catch up, to see you both. And good wishes to you both as you continue your journeys, and to everyone here, that as we leave, we untie the bundle that brought us together, and we give thanks to Creator Creation that we've had the opportunity to come together to share, that good words were shared, and with the intention only of educating and helping one another out as we go on. Dr. Hill has a video that may be able to be put up onto the website. Brianna will be in touch with you about that, Karen. And to all, we wish you a very beautiful day. And again, Yaogoa, Miigwech, merci beaucoup for your time and attention, and best wishes to you all.
Hi, thank you. Have a good day, everybody.
No louder.